So good morning. Good morning to all of you. Okay, starting with this muscles of the forearm and carpal tunnel. I am Dr. Pradeep Pawar, Professor of Anatomy, having a vast teaching experience for the undergraduates and the postgraduate students and for the entrance preparations, India and abroad. Now, let us start with the forearm. We start with the front of the forearm, Now students, muscles in the front of the forearm or the anterior compartment of the forearm are divided into three sets. I classify this as three sets: a superficial, intermediate and the deep set. Superficial, intermediate and deep set. This classification is easy to understand the spaces of the forearm. So then it becomes easy. Okay. So let us understand the superficial muscles first. The superficial muscles are 5 in number. 5. Clear. And what is the origin of all these muscles? They arise from the medial epicondyle of the humerus. Medial epicondyle. So 5 muscles arise from the medial epicondyle of the humerus. And if you place the 5 muscles like this here, so the first muscle does this. The first muscle does this. What is this for the forearm? Pronation. So the muscle would therefore be known as what? The pronator teres. Pronator teres. The next 4 muscles are going to cross this joint. What is this? The wrist joint. They cross this joint, wrist joint. Pronator teres doesn't cross the wrist joint. It is inserted on the radius. So the next 4 muscles are going to cross this wrist joint. They're going to do this to the wrist. What is this for the wrist? Flexion. So these are the flexors of the wrist. The flexors of the wrist joint is also known as the carpal joint. So these are the flexors of the carpal joint. Okay, flexors of the carpal joint. So one is on the radial side. One is towards the radial aspect, towards the radial bone. What do you call this as? The flexor carpi radialis. Flexor carpi radialis. One is towards the ulnar side, towards the ulna. What do we call this as? The flexor carpi ulnaris. Flexor carpi ulnaris. Now one muscle has got a small belly and a long tendon. A small belly and a long tendon, and this is what we call as the flexor digitorum. This is what we call as the Palmaris Longus. I'm so sorry. Palmaris Longus. A small belly and a long tendon, therefore known as Palmaris Longus. And there's one muscle which comes here and divides into 4 tendons, and these tendons go into the digits. They cause flexion of the digits. This is the flexor digitorum, and it's a superficial muscle. It is therefore known as the flexor digitorum superficialis. Flexor digitorum superficialis. Fine. Okay, so I'll just write these muscles for you. Have a look and understand this. Just one moment. Okay. Just one moment. So we'll start with the muscle. The first muscle is pronator teres. Now students, what is important about this muscle? Now this pronator teres है ना, इसके 2 heads होते हैं. There are 2 heads for this muscle, pronator teres. One is the one which begins from the humerus. So we call this as the humeral head. Humeral head. And the other one begins from the ulnar. So this is what we call as the ulnar head. Just understand this. Humeral head and ulnar head. So one begins from the humerus, one begins from the ulnar. The humeral head is also known as the superficial head. Superficial head. And the ulnar head is known as the deep head. Deep head. So superficial and deep heads of pronator teres. One begins from the humerus, one begins from the ulna. Students, can you tell me, out of these 2 heads, which is the head which is going to act on the elbow joint? Chalo, answer this. Which is the head going to act on the elbow joint out of the superficial and deep head of pronator teres? Yes, students, answer. Be interactive. So it would be easy to understand for you. Bolo. The superficial head begins from the humerus, the deep head begins from the ulnar. So out of these two heads, which head is going to act on the elbow joint? Yes, that would be the superficial head, correct, superficial head, because the deep head arises from ulnar. The deep head does not cross the elbow joint. Following this, so the deep head is not going to act on the elbow joint, so it is the superficial head which will cause flexion at the elbow joint. Now, why am I telling you this? Because between these two heads, there's someone who passes between these two heads, the medial nerve. The medial nerve passes between the two heads. Okay, I'll just mention this. The medial nerve passes between the two heads. Between the two heads. Just remember this. And the medial nerve can get compressed between the two heads. Okay, the medial nerve can get compressed here, and this is what we call as the Pronator Tears syndrome. Pronator Tears syndrome. So what is Pronator Tears syndrome? It is the compression of the medial nerve between the two heads of Pronator Tears. Clear? Compression of medial nerve between the two heads of Pronator Tears is known as the Pronator Tears syndrome. And there's someone who goes deep to the deep head. Who goes deep to the deep head? The ulnar artery. This all points are very important, students. Ulnar, understand this. The ulnar artery passes deep to the deep head. Deep to the deep head. I hope you are understanding this. That means, look, if I make it like this, अगर ये superficial head है, ये deep head है. That's the superficial and deep head of Pronator Tears. Now, what is the one which passes between the two heads here? The medial nerve. The medial nerve passes between the two heads. And what is the one which passes deep to the deep head? That's an ulnar artery. Ulnar artery. In other words, who's going to separate the medial nerve from the ulnar artery? Who's going to separate the medial nerve from the ulnar artery? What is this going to be? The deep head of Pronator Tears. The deep head of Pronator Tears. Is this following? Is this clear to all of you? Are you all following this? So this MCQs are very important. That's about the Pronator Tears. Now, where is the insertion of Pronator Tears? ये insert कहाँ पे होता है? I'll just make a slide for you if you can understand this. Look, I'll clear this. Right. So now, where's the insertion of Pronator Tears? Have a look. That's the head of the radius, students. That's the neck of the radius. What do you call this as? The radial tuberosity, and that's the shaft of the radius. The shaft. This is the styloid process of radius. अब क्या करते हैं? We divide this radius into two half. We divide this radius into two half. So this is the middle half of the shaft of radius. Middle half of the shaft of radius on this aspect. What is this aspect? The lateral aspect. Lateral aspect. So where is the insertion of Pronator Tears? It is inserted on the lateral aspect of the middle half of the shaft of humerus. Lateral aspect of the middle half of the shaft of humerus. Is this clear? So just draw this first. Lateral aspect. Lateral aspect of middle half of the shaft of radius. Okay, perfect. Lateral aspect of the middle half of the shaft of radius. Students, can you tell me वैसे ही जैसे ये है, similarly there's someone who is inserted on the middle half of the shaft of the humerus on the medial aspect. Can anyone answer this? There's someone who is inserted on the shaft of the humerus, middle half on the medial aspect. Come on, students, answer this. Can anyone answer this? What is the name of the muscle which is inserted on the humerus? That's the coracobrachialis. Coracobrachialis. And on the lateral aspect of the middle half, that's the deltoid of the humerus. So just remember these landmarks. These are very important. Okay. So the first muscle is Pronator Tears. The second muscle is Flexor Carpi Radialis. Flexor Carpi Radialis. The third muscle is Palmaris Longus. Palmaris Longus. The fourth muscle is Flexor Digitorum Superficialis. Flexor Digitorum Superficialis. And the last muscle is Flexor Carpi Ulnaris. Flexor Carpi Ulnaris. The last muscle is Flexor Carpel. Just remember it like this. These are the superficial muscles. Okay. Pronator Tears, the Flexor Carpel Radialis. Brachialis is below the medial half, below the middle half of the shaft of humerus. Very good. But who's inserted on the medial aspect of the middle half of the shaft? Very good, Sparsh. That is coracobrachialis. Samajh mein aaya na? Just try to compare it to the insertion of Pronator Tears. That is what I was trying. Okay, very good. Fine. So these are the muscles: the Pronator Tears, the Flexor Carpel Radialis, the Palmaris Longus, the Flexor Digitorum Superficialis, and the Flexor Carpi Ulnaris. Right. Out of all this, one muscle whose insertion is very important. What do you say about the Flexor Digitorum Superficialis, students? This Flexor Digitorum Superficialis has 4 tendons for the 4 digits. 4 digits ke liye it has got 4 tendons. Each tendon at the base of the proximal phalanx. At the base of the proximal phalanx, each tendon divides into 2 slips. ऐसे 2 slips में divide होता है. At the base of the proximal phalanx, each tendon divides into 2 slips, and this is inserted on the base of middle phalanx. It is inserted on the base of the middle phalanx. Students, this is extremely important. Tell me now, that means Flexor Digitorum Superficialis kahan se arise hoga? Where does it begin from? The medial epicondyle of the humerus. Which joint is it crossing? Number 1, elbow joint. Number 2, wrist joint. Number 3, the metacarpophalangeal joints. And number 4, the proximal interphalangeal joint. The proximal interphalangeal joint. Does it cross the distal interphalangeal joint, students? No, it doesn't cross the distal interphalangeal joints. So is it going to act on the distal interphalangeal joints? No. Following this, because the Flexor Digitorum Superficialis ka insertion is on either sides of the base of the middle phalanx. Either sides of the base of middle phalanx. I'll just write this for you. Pehle dekh lo, understand this, and then we'll start. Flexor Digitorum Superficialis, a very important MCQ, a very important visual slide. Flexor Digitorum Superficialis. I'll just write this for you. It has 4 tendons, right? It has 4 tendons for 4 fingers. It has 4 tendons for 4 fingers, right? 4 fingers के लिए 4 tendon. At the base of proximal phalanx, each tendon divides into 2 slips. Each tendon divides into 2 slips. 2 slips समझो ऐसे divides into 2 slips. SLIPS, slips. And where is this inserted? Inserted on either sides of base of middle phalanx. Inserted on either sides of the base of middle phalanx. Okay, is this clear? Now see, for example, if I draw this here, if I draw a finger here for you, that's the distal phalanx, that's the middle phalanx, that's the proximal phalanx. Okay? Now this tendon of Flexor Digitorum Superficialis comes here like this. This is one tendon that I'm drawing. Now at the base of proximal phalanx, it divides into 2 slips. As if those slips may divide hota hai, and this is inserted on the base of middle phalanx here. Inserted on the base of middle phalanx. So this is the Flexor Digitorum Superficialis. I hope this is clear to all of you. Very good. Karnathi. Okay, and there's one tendon which goes below the superficialis. Ye superficialis ke niche se jayega, and this will get inserted into the base of distal phalanx. Yeah, this is another tendon. I'm just showing you. I'm just drawing it here for you. What is this tendon of? Can anyone answer this? This is deep to the superficialis, and this tendon goes and gets inserted into the base of the distal phalanx, and this is the tendon of Flexor Digitorum Profundus. You have profundus ka tendon, the Flexor Digitorum Profundus. Perfect. So this is the Flexor Digitorum Superficialis which I have drawn for you. I'll show you the slide in one moment. Have a look, understand this. So I think this is clear to you. I hope this is clear to all of you. Just have a look at the slides. Huh? Ye slides dekh lo pehle. So then we'll start. Okay, answer this now. What is this tendon? What is this muscle? The first muscle. These are the superficial muscles. Huh? Superficial. So ye kaun hai? Pronator Tears. What is this muscle? That's the Flexor Carpi Radialis. This muscle has got a small belly and a long tendon. What's that? Palmaris Longus. What is this? This is the Flexor Digitorum Superficialis. And what's that? The Flexor Carpi Ulnaris. I hope these 5 tendons are clear to you. Perfect. Right? Now have a look at this slide also. A different type of slide. Yo, that's the Pronator Tears. That's the Flexor Carpi Radialis. Ye hoga Palmaris Longus. This is the Superficialis. And this is the Flexor Carpi Ulnaris. Students, can you tell me what is this? Yes, Karnati, what is this? What is this that I am pointing here? What is this? Anyone? This is the, any guesses? This is the Bicipital Aponeurosis. Yes, this is the Bicipital Aponeurosis. This biceps ka tendon, where is it inserted into the radial tuberosity? Then it sends a small extension. It's an aponeurosis. And this is what we call as the bicipital aponeurosis. And where is it going to lie? In the roof of cubital fossa. It lies in the roof of the cubital fossa. Correct? So that's it. So I hope this is the superficial muscles which are clear to you. Just see this dissected specimen for you. What is this? Once again, that's a Pronator Tears. That's a Flexor Carpi Radialis. Ye hai Palmaris Longus. Here would be the superficialis. And the last tendon that you're seeing is the Flexor Carpi Ulnaris. Flexor Carpi Ulnaris. Okay, perfect. Perfect. Now just look at this slide and you tell me what is this tendon of which divides into 2 slips. Look at this. Ye jo tendon dekh rahe ho, it divides into 2 slips and gets inserted into the base of middle phalanx. This is the tendon of Flexor Digitorum Superficialis. And what is this tendon which is going and getting inserted into the base of the distal phalanx? That's the Flexor Digitorum Profundus. Ye hoga profundus. And this is the superficialis. Okay, so these are the superficial muscles. Now coming to the intermediate muscles, have a look. Coming to the intermediate muscles. Right. Now intermediate and deep. Ek tha superficial set, the second one is the intermediate muscles. Intermediate. So intermediate mein 2 muscles hai. One which begins from the radius. Now, the superficial muscles ka origin was what? It was arising from the medial epicondyle of the humerus. Those were the superficial muscles. The intermediate and the deep muscles, they would arise from the bones of the forearm. Which are the bones of the forearm? The radius and the ulna. Radius and ulna. So now you tell me there's one muscle which begins from the radius, and the muscle which begins from the radius goes to the thumb. It goes to the thumb. It does this for the thumb. This for the thumb. What is this? You have flexor of the thumb. What is the thumb known as? Pollicis. And it's a long muscle. We call this as the Flexor Pollicis Longus. Flexor Pollicis Longus. Okay. So that's the Flexor Pollicis Longus. So where is the Flexor Pollicis Longus? Arising from radius. It arises from the radius. And this Flexor Pollicis Longus will go and get inserted into the distal phalanx of the thumb. See, as a rule, students, as a rule, the long muscles are inserted into the distal phalanges, the bases of distal phalanges. And the short muscles, the small muscles are inserted into the bases of proximal phalanges. Okay, just remember that. So this is Flexor Pollicis Longus. Sorry. And there's a second muscle which is arising from the ulna. This is the Flexor Digitorum Profundus. Flexor Digitorum Profundus. Where will the profundus begin from? Ulna. The profundus will begin from the ulna, and again the profundus has got 4 tendons. Iske 4 tendons honge, and where are the tendons inserted into? Yes, answer this. The tendons of profundus are inserted into the bases of the distal phalanx. They are inserted into the bases of distal phalanx. I'll just mention it here. Inserted into the base of distal phalanx. Inserted into the base of the distal phalanx. And coming to the last muscle, the deep muscle. Deep muscle is a quadrangular muscle which is going to do this. What's this? Pronator Quadratus. The deep muscle is going to be the Pronator Quadratus. Okay, बस ये sequence है, ये sequence याद रखना. Superficial 5 है, intermediate 2 है. The one which begins from the radius is the flexor pollicis longus. From the ulna is the flexor digitorum profundus. And the last muscle is the Pronator Quadratus. Begins from the ulna, inserts on the radius. That's the Pronator Quadratus. Okay, have a look at this muscles now. Have a look at the slide. Yeah. So this is it. अब है ना इसे निकाल देते हैं. If you remove this, one moment, I'll put the pointer for you. ये what is this muscle? If you remove this muscle, you remove this muscle. ये दोनों intermediate muscle को निकाल देते हैं. You find this deep muscle here. This deep muscle would be like this. It would be a quadrangular muscle here, and yes, this is what we call as Pronator Quadratus. This deep muscle is the Pronator Quadratus. What is this muscle? This muscle begins from the radius, goes to the thumb. Begins from the radius, goes to the thumb here. This is the flexor pollicis longus. This is the muscle which begins from the ulna and goes to the digits here. What is that? The flexor digitorum profundus. Flexor digitorum profundus. I hope this is clear to all of you. And then we place the 5 muscles on this. We place the 5 superficial muscles on this. Okay. Any doubts till here? Any doubts, students? You have, you tell me. Till here. Now I'll draw a slide for you. Look, I'll draw a slide for you. A very nice slide. बस ये slide याद रखना. All the concept will be clear to you. Have a look. I draw this as the radius, and I draw this as the ulna. Radius and ulna. Just a representation, diagrammatic representation for you. Now tell me, students, what is this muscle which begins from both radius and ulna, which is attached to both radius and ulna? What is this muscle? That's the Pronator Quadratus. ये होगा Pronator Quadratus. What is this muscle which begins from the radius here? A muscle which begins from the radius and a muscle which begins from the ulna here. What's this going to be? Flexor pollicis longus. And what is this going to be? The flexor digitorum profundus. Flexor pollicis longus, flexor digitorum profundus. And now we place the 5 superficial muscles here. 5 superficial muscles रख देते हैं. The first one, Pronator Tears, the flexor carpi radialis, the Palmaris longus, the flexor digitorum superficialis, and the flexor carpi ulnaris. This is lateral side and this is the medial side. Lateral and medial. ठीक है? Now we place 2 nerves here. तो nerves लगा देते हैं यहाँ पे. There is one nerve here and there's one nerve here. Okay, so what is this nerve going to be? Ulnar. And what is this nerve going to be? The medial nerve. Okay, so एक ulnar nerve है, एक medial nerve है. Okay, just draw this slide. बस इतना slide याद रखना. The entire nerve supply of this is going to be clear to you. Just draw the slide. Right? Draw the slide. So radius and ulna, the bones here, this muscle, the deepest one is the Pronator Quadratus. The 2 intermediate muscles, the flexor pollicis longus and the flexor digitorum profundus, and the 5 superficial muscles here. You've got 2 nerves in the front of the forearm. One is the medial nerve and the other one is the ulnar nerve. Ulnar nerve. Okay, now what is the nerve supply of this? बस ये slide याद रखना बच्चों. If you remember the slide, the entire concept is going to be clear to you. I'll just remove this. ये ulnar nerve निकाल दिया and I'll just remove this for you. The medial nerve. Okay, we start now. Now tell me, students, I'll start. The ulnar nerve, look. The ulnar nerve is lying below which muscle? Tell me. The ulnar nerve is lying below which muscle? The ulnar nerve is lying below the flexor carpi ulnaris. Barabar. Look at this slide. The ulnar nerve is lying below the flexor carpi ulnaris, and the ulnar nerve is lying on which muscle? It is lying on the flexor digitorum profundus. It's lying on the flexor digitorum profundus. So ulnar nerve would supply these 2 muscles. ये 2 muscles को supply करेगा ulnar nerve. It will supply a muscle below which it lies and a muscle on which it lies. So what is the ulnar nerve going to supply? It would supply the flexor carpi ulnaris, and yes, it would supply the flexor digitorum profundus. Now, but look, on the profundus there are 2 nerves. 2 nerves है. which are lying on the profundus. One is ulnar nerve, one is medial nerve. There are two nerves lying on the profundus. So both these nerves would want to supply the profundus. Both of them are lying on the profundus, correct? So दोनों को profundus को supply करना है. So how will they divide the profundus? How will they divide it? They will divide it into half. So half. So which half would be supplied by ulnar nerve? Which half of profundus would be supplied by ulnar nerve? The medial half of profundus. I hope you're following this. So the medial half of flexor digitorum profundus would be supplied by ulnar nerve. And who else would the ulnar nerve supply? The flexor carpi ulnaris. That means out of all these muscles in the forearm, what is the ulnar nerve going to supply? The flexor carpi ulnaris and the medial half of the flexor digitorum profundus. Is this clear? Medial half of profundus. Right. Rest all the muscles will be supplied by which nerve? Medial nerve. Rest all the muscles would be supplied by the medial nerve. Clear? But now see, again it is not like this. It may be thoda sa difference here. There is a slight difference in this. I'll make this as ulnar nerve for you. Okay. Ulnar nerve. And look, the rest of the muscles here. Out of all these muscles, these four muscles are supplied by whom? These four muscles are supplied by medial nerve. ये चार muscles, बस. Medial nerve supplies only the four superficial muscles. Only four superficial muscles the medial nerve supply. So now who's left? Who's left for us? One is the flexor pollicis longus, the pronator quadratus, and the lateral half of profundus. Students, the flexor pollicis longus, the pronator quadratus, and the lateral half of profundus. This would ideally be supplied by whom? This should ideally be supplied by medial nerve. But medial nerve supplies only the four superficial muscles and goes to the hand, because it has to supply the muscles in the hand. So these three muscles are left. Who supplies this? The medial nerve now gives a branch here. And ये medial nerve है ना? It gives a branch here, students, and this branch goes and supplies. This branch is a deep branch of medial nerve. Where do we search this branch? आप सारे muscles निकाल दो. You remove all the muscles. You find these two bones now. What are these two bones? The radius and ulna. And what is between the radius and ulna? The interosseous membrane. And this nerve lies on the anterior aspect of the interosseous membrane. And this is what we call as anterior interosseous nerve. Anterior interosseous nerve. So this is the anterior interosseous nerve which is going to supply these muscles. ये होगा anterior interosseous nerve. Just remember it like this. Anterior interosseous nerve. So what is anterior interosseous nerve? It is nothing but the deep branch of medial nerve. That's a deep branch of medial nerve. Okay. So that's anterior interosseous nerve. I hope everything is clear to all of you. देख लो ये एक बार, just go through it. If it's not clear, you tell me. I'll just remove this. So that's anterior interosseous nerve. There are plenty of MCQs on this topic, so be clear. Right. And then why do we divide this? देखो books में ना थोड़ा सा differently दिया है. I made it slightly different for you. Why? You know, because if you understand this, you understand something very important here. There's a space here, students. There's a space in the forearm here, and this space is lying between the intermediate and the deep muscles. Right? They lie between the intermediate and the deep muscles. Which are the intermediate muscles? The flexor pollicis longus and the flexor digitorum profundus. And which is a deep muscle? Pronator quadratus. And this space is known as the, yes, this is the forearm space of Palmar. Forearm space of Palmar. That's it. So that's the forearm space of Palmar. And where does this forearm space of Palmar lie? Between the intermediate and the deep muscles of the forearm. I hope this is clear to all of you. That's the forearm space of Palmar. Any doubts in this? You tell me. इसमें कुछ doubts है forearm में तो बोलो. I'll show you some MCQs. Okay, then I'll proceed. Fine, students. Right. So look at some MCQs now. Answer this. A football player presents to your clinic with a swollen index finger. When told to make a fist, the young man can bend his index finger at the proximal interphalangeal joint but not at the distal interphalangeal joints. Which tendon is likely ruptured in the injury? Answer this. Yes, very good. Yes, the rest of you also answer, students. So देखो, he can bend his index finger at the proximal interphalangeal joints but cannot bend at the distal interphalangeal joints. So now you know who's going to flex the distal interphalangeal joint, students. That's the flexor digitorum profundus, right? That's the flexor digitorum profundus. So this would be the injury to FDP. Flexor digitorum profundus. Clear? Simple, eh? But this is how the MCQs are asked. Correct. Very good. Have a look at this slide. This is a very good slide, students. This is a very good slide. Now try to identify this muscle. I'll just put a pointer for you. Ye muscle ko nikal to. What is this? This muscle, a quadrangular muscle here, which does pronation. What's this? The pronator quadratus. What is this muscle going to be? Which goes to the thumb. This is the flexor Palmaris Longus. What is this muscle? This is the flexor Digitorum profundus. That's a profundus. Now what did I tell you? On the profundus we put two nerves. What is this nerve? On the medial aspect, that's the ulnar nerve. Look at this. This is the ulnar nerve on the medial aspect. And what is this nerve? That's the medial nerve. Ye ulnar nerve hai, and that's the medial nerve. We've cut the medial nerve. And look at this, students. That is the deep branch of medial nerve. Yo. That's a deep branch of medial nerve. And what is this now? That's the anterior interosseous nerve. That's the anterior interosseous nerve. That's a deep branch of medial nerve. And this anterior interosseous nerve is going to supply what? It supplies the flexor Palmaris Longus, the Pronator Quadratus, and the lateral half of profundus. Perfect. And now see, this is a medial nerve. So what have we cut here to see the medial nerve? Nahin to medial nerve dikhta nahi hai na. Medial nerve you normally cannot see because who's going to cover the medial nerve? The Pronator Tears. Which head of Pronator Tears is going to cover the medial nerve? The superficial head. The superficial head of Pronator Tears is going to cover the medial nerve. Now we cut the superficial head. Superficial head ko cut kiya. What is this now? That's a medial nerve. That's a medial nerve. So what is this head of Pronator Tears? That's the deep head of Pronator Tears, right? This is the deep head of Pronator Tears. That's the superficial head which we have cut, and ye hai deep head of Pronator Tears. And what passes between these two heads is the medial nerve. That's a medial nerve. And now if you remove this deep head, students, dekho, you remove this deep head. What is this artery? Ye dekh rahe ho? What is this artery? Just one moment. What is this artery? You tell me. What is this artery? That's the, ye kaun hai? This is the brachial artery. Now this brachial artery divides into two branches here. Brachial artery divides into two branches here. What is this now? That's a radial artery, and that's a ulnar artery. Radial and ulnar. And this ulnar artery goes deep to the deep head. So what goes deep to the deep head of Pronator Tears? The ulnar artery. So who's going to separate the medial nerve from the ulnar artery? Ab samajh mein aaya? Is this clear now? The medial nerve is separated from the ulnar artery by the deep head of Pronator Tears. By the deep head of Pronator Tears. Okay, I hope this should be clear. That's the ulnar artery. That's a medial nerve. That's the deep head of Pronator Tears. Superficial head we have cut. And what is this nerve? That's the anterior interosseous nerve. Can anyone guess what is this artery? Yes, Pash? Yes, Karnati, what's this artery? Bol sakte ho? What is this artery? Come on, the rest of you be interactive. So it will be easy. What is this artery? Can anyone tell this artery? ये anterior interosseous nerve है ना, so this is going to be the anterior interosseous artery. This is the anterior interosseous artery. Okay, that I'll tell you later. Perfect. Is this clear to all of you? Any doubts? Just see some MCQs here. answer this. During dissection, a first year student finds a nerve lying on the anterior aspect of interosseous membrane. He identifies it as the anterior interosseous nerve, and the student knows the anterior interosseous nerve is a deep branch of medial nerve. Lesion of this nerve would spare. Yes, what do you think? What do you say is the answer? Lesion of this anterior interosseous nerve would spare which muscle? क्या बोलते हो? Yes? Answer. Lesion of anterior interosseous nerve is going to spare. The best answer is Pronator Tears. The best answer would be Pronator Tears. Right? Because देखो ना, anterior interosseous nerve supplies Pronator Quadratus. Yes, it supplies the Pronator Quadratus. It supplies the Flexor Pollicis Longus. Yes, it supplies the Flexor Pollicis Longus. And it supplies the Flexor Digitorum Profundus. Yes. Now, which half of profundus does it supply? Which half of profundus does the anterior interosseous nerve supply? The lateral half of profundus, right? It supplies the lateral half of profundus. But the Pronator Teres is completely supplied by whom? The Pronator Teres is completely supplied by medial nerve. So answer for this would be Pronator Teres. Okay, answer this. Infection from the hand spreads to the forearm. Yes, infection from the hand spreads to the forearm in the space of Parona. Boundaries of this space are all except. Answer the students. Come on. Answer. I'm waiting for your answer. Boundaries of forearm space of Parona. Flexor carpi radialis, except flexor carpi radialis. Very good. So the forearm space of Parona के superficial boundaries क्या होते हैं? What is the superficial boundary? The flexor pollicis longus and the pronator quadratus. Correct? Flexor pollicis longus and the pronator quadratus. I'm so sorry. Flexor pollicis longus and the flexor digitorum profundus. Sorry. And what is the deep boundary? The pronator quadratus. Right? I hope this is clear to all of you. Any doubts, students? Any doubts in this? Okay. Now, coming to another topic. Look, students. ये देखो. अब है ना, understand this. A very important topic. Now, see this carpal bones. This carpal bones are scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. This carpal bones are not placed in a straight line. As a straight line में नहीं होते ये. They are placed in a form of a concavity. They are concave, scaphoid, lunate, triquetral, pisiform. Like this, they are placed in the form of a concavity. And students, who's going to connect the two ends of this bones? Who's going to connect the two ends? The flexor retinaculum. These two ends will be connected by the flexor retinaculum. Right? Now this flexor retinaculum, have a look at this. So what is this going to be? Ye hai flexor retinaculum, and these are the carpal bones. Now between the carpal bones and the flexor retinaculum, you get a tunnel here. Yes, and this is what we call as the carpal tunnel. इसे हम बोलेंगे carpal tunnel. Right? Now, understand this carpal tunnel. What are the structures which are passing through the carpal tunnel, and what are the structures which go outside the carpal tunnel? This is extremely important, students. Okay, and I'll just draw this carpal tunnel for you. Look, I made this 4 carpal bones here. These are the 4 carpal bones. If this is medial and this is lateral. Who's joining these two ends of the bones? The flexor retinaculum. And this flexor retinaculum, on the lateral side, it splits. The flexor retinaculum divides on the lateral side. It splits on the lateral side into 2 slips. Those slips may divide hota hai on the lateral side. Now, clear? So between this carpal bones and the flexor retinaculum, what is this tunnel known as? Ye hai carpal tunnel. This is the carpal tunnel. So these are the carpal bones, that's the flexor retinaculum. The flexor retinaculum on the lateral side splits, it divides into 2 slips. Right, and this is the carpal tunnel. Now students, you have to know what are the structures which are passing through the carpal tunnel and what are the structures which go above the flexor retinaculum. Above the flexor retinaculum. Okay, I'll start. Yeah, this tendons will be crossing this now and entering the hand. So these are the tendons which will be passing through the carpal tunnel. Okay, we start with the first tendon. The superficial muscle, the first superficial muscle, what was that? Pronator Tears. Now students, where is the insertion of Pronator Tears? It is inserted on the radius. Done, khatam. So is the Pronator Tears going to cross the wrist? No, it doesn't cross the wrist because it is inserted on the radius. So forget Pronator Tears. Come to the second muscle of the forearm, the superficial muscle, second number. That's the Flexor Carpi Radialis, and this Flexor Carpi Radialis passes to this split of the Flexor Retinaculum. That's the Flexor Carpi Radialis. The third tendon is the Palmaris Longus, and this Palmaris Longus goes from above. ये ऊपर से जाता है, Palmaris Longus. The next are the four tendons of the Flexor Digitorum Superficialis. The four tendons of Flexor Digitorum Superficialis. And the last one is the Flexor Carpi Ulnaris. Where is the insertion of Flexor Carpi Ulnaris? It's inserted on the pisiform bone. ये pisiform bone पे insert होता है, so it doesn't cross here. Now, coming to the intermediate and the deep muscles. The intermediate muscle, the first one is the Flexor Pollicis Longus, and these are the four tendons of Flexor Digitorum Profundus. ये चार tendons हैं profundus के, ठीक है? So these Pronator Quadratus is a quadrangular muscle here, so it is not going to cross. So students, what are the structures which go through the carpal tunnel? One is the Flexor Pollicis Longus. Then are the four tendons of Flexor Digitorum Superficialis and the four tendons of Flexor Digitorum Profundus. The Flexor Carpi Radialis does not pass through the carpal tunnel. Remember, it passes through the split of the Flexor Retinaculum. Perfect. Now students, when we move the wrist, when you're moving the wrist, there's going to be a friction. Friction hoga, obviously, when you move the wrist. So, to prevent the friction, this four tendons of superficialis and this four tendons of profundus, they are put in a synovial sheath. And what is this synovial sheath? Which encloses the tendons of Flexor Digitorum Superficialis and Profundus, known as, we call this as the ulnar bursa, with the tendons of, I'll write it like this, tendons of Flexor Digitorum Superficialis and Flexor Digitorum Profundus. So that's the ulnar bursa. A very important MCQ. Ulnar bursa encloses the tendon of what? Your answer would be the Flexor Digitorum Superficialis and Profundus. And tell me students, what is this bursa? देखो bursa क्या होता है? What is a bursa? Bursa is a fluid-filled sac. A fluid-filled sac. To prevent friction. It's like that. That's a bursa. So the bursa which encloses the tendon of Flexor Pollicis Longus. What's this? ये होगा radial bursa. This is going to be the radial bursa with the tendon of Flexor Pollicis Longus. Perfect. What is this tendon of Flexor Carpi Radialis? And now students, look at this. There's someone here. There's someone who's going between the Flexor Retinaculum and the ulnar bursa. Any guesses here? Any guesses? ये कौन है? Between the Flexor Retinaculum and the ulnar bursa. Yes, that's the medial nerve. Very good. That's the medial nerve. So who's going between the Flexor Retinaculum and the ulnar bursa? The medial nerve. And students, when there's an ulnar bursitis, look, when there's the inflammation of the ulnar bursa, now this medial nerve gets compressed between the Flexor Retinaculum and the ulnar bursa, and this compression of medial nerve in the carpal tunnel is known as the carpal tunnel syndrome. Right? The compression of medial nerve in the carpal tunnel is known as the carpal tunnel syndrome. Very clear. Now tell me, जैसे ये Flexor Retinaculum divides on the lateral side, it splits into two tendons. Similarly, the Flexor Retinaculum gives a small extension on the medial side. A small extension on the medial side. And what is this extension known as? This is what we call as the volar carpal ligament. Volar carpal ligament. ये है volar carpal ligament. And now students, between the volar carpal ligament and the Flexor Retinaculum, there's a small tunnel. ये छोटा सा tunnel बनता है. And what do you call this tunnel as? the Guyon's tunnel. So that's the Guyon's tunnel, right? So what is Guyon's tunnel? It's lying between the flexor retinaculum and the volar carpal ligament. Volar carpal ligament. And what are the structures which are passing through this Guyon's tunnel? One is the ulnar nerve, and ulnar artery. Ulnar nerve and ulnar artery. They pass through the Guyon's tunnel. Okay, then there's something else also which passes here. You can just draw the slide if you want. I'll label this for you. These are the structures which go above the flexor retinaculum. A very important MCQ. A very important MCQ. I'll just put numbers for you. 1, 2, 3, 4, 5. Okay. You meet another. Okay, just draw this and finish this. Yes, Aman. Okay, just draw this, finish this. So these are the structures which go above the flexor retinaculum. ये 1, 2, 3, 4, 5 ये क्या structures है? I'll tell you that. बाकी the structures passing deep to the flexor retinaculum, structures passing to the carpal tunnel, clear है बच्चों? This is the flexor Pollicis Longus with radial bursa. This is the flexor Digitorum Superficialis and Profundus with ulnar bursa. That's the tendon of flexor Carpi Radialis. This is the medial nerve. Now these are the structures which go above the flexor retinaculum. I'll tell you that. Once you've done, just put your thumbs up. So I'll proceed. A very important MCQ, a very important clinical MCQ. Structures passing above the flexor retinaculum. Okay, I'll start. Now understand this. What are the structures which pass above the flexor retinaculum? I'll have to put a screen for you. Okay, I'll start. Structures passing above the flexor retinaculum. Number 1. ये जो number 1, 1, 2, 3, 4, 5 मैंने लिखा है ना. So number 1 is the ulnar nerve and vessels. Ulnar nerve and vessels passes below volar carpal ligament, passes below the volar carpal ligament through Guyon's tunnel. Clear? So ulnar nerves and vessels, they pass below the volar carpal ligament. That ligament is the volar carpal ligament, and they pass through that tunnel. What is that tunnel known as? Guyon's tunnel. Guyon's tunnel. Second. Now tell me students, what is this eminence? ये क्या eminence होता है? ये, this one. ये होता है thenar eminence. This is a thenar eminence. And what is this eminence? That's the hypothenar eminence. ये है hypothenar eminence. That's a thenar and that's a hypothenar eminence. Now, who supplies the skin over the thenar eminence? Who supplies the skin here and who supplies the skin over the hypothenar eminence? Understand this. See, simple as simple. Tell me students, which was the nerve on the medial aspect in the forearm? Forearm में medial aspect पे कौन सा nerve था? Which was the nerve on the medial aspect in the forearm? Ulnar. Very good, ulnar. And which is the nerve on the lateral aspect in the forearm? The medial nerve. समझ में आ रहा है? In the forearm, on the medial side, on the profundus, which nerve was that? Ulnar nerve. And on the profundus, on the lateral side is medial nerve. So, in the hand, everything on the medial side would be supplied by ulnar nerve, and everything on the lateral side would be supplied by medial nerve. It would be supplied by medial nerve. Right? So, who supplies the skin over the thenar eminence? That's medial nerve. And who supplies the skin over the hypothenar eminence? That's ulnar nerve. ये है ulnar nerve. But ये medial and ulnar nerve themselves do not supply. They themselves do not supply. No. They give branches here. They give branches, and these branches are going above the flexor retinaculum, and these branches will supply the skin here. What do we call this as? We call this as palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of ulnar nerve. What is this going to supply? The skin over hypothenar. Skin over the hypothenar eminence. Skin over the hypothenar eminence. Third tendon is Palmaris Longus. Palmaris Longus. The fourth, palmar cutaneous branch of medial nerve. Palmar cutaneous branch of medial nerve. अब ये क्या सप्लाई करेगा? It supplies the skin over thenar eminence. It supplies the skin over thenar eminence. And fifth is the superficial palmar branch of radial artery. The last one, number 5. अब ये क्या है superficial palmar branch? What happens to it? That all we'll see later. So superficial palmar branch of radial artery. That's number 5. So these are the structures which go above the flexor retinaculum. Students, a very important MCQ. Very important MCQ. So medial से lateral आप जाओ. Medial से lateral. The first one, once again. आप लिख लो, then I'll tell you. Okay, so the first one is the ulnar nerve and vessels, and this ulnar nerve and vessels will enter the hand through. There's a tunnel here named the Guyon's tunnel. The Guyon's tunnel. And how is the Guyon's tunnel formed? It is formed between the flexor retinaculum and the volar carpal ligament. Flexor retinaculum and volar carpal ligament. That's the Guyon's tunnel. What passes through the Guyon's tunnel? Ulnar nerve and vessels. The second one is the one which supplies the skin over the hypothenar eminence. What is this? The palmar cutaneous branch of ulnar nerve. And the palmar cutaneous branch of ulnar nerve है ना, ये flexor retinaculum के ऊपर से जाएगा. It will go above the flexor retinaculum and it would supply the skin over the hypothenar eminence. The third one is the tendon of Palmaris Longus. Palmaris Longus. The fourth one supplies the skin here. That's the palmar cutaneous branch of medial nerve. And what is it going to supply? The skin over the thenar eminence. It supplies the skin over the thenar eminence. And the last is the superficial palmar branch of radial artery. अब ये क्या होता है? What happens to it? It goes in the hand. Then what happens? I'll tell this later. The superficial palmar branch of radial artery. I hope this is clear to all of you. Just have a look at the slide. So, this was the slide that I had drawn. ये देखिए. So what is this? That's a Guyon's tunnel. This is the ulnar nerve and vessels. This is the palmar cutaneous branch of ulnar nerve. Palmaris longus, palmar cutaneous branch of medial nerve, and that's the superficial palmar branch of radial artery. Ek minute, students, just tell me, how does the medial nerve enter the hand? Students, how does the medial nerve go to the hand? It goes through carpal tunnel. It goes through the carpal tunnel. And how does this palmar cutaneous branch go? The palmar cutaneous branch of medial nerve goes above the flexor retinaculum. ये flexor retinaculum के ऊपर से गया and supplies the skin over the thenar eminence. Now students, when there's a carpal tunnel syndrome, when the medial nerve gets compressed in the carpal tunnel, जो medial nerve hand में supply करती है, whatever medial nerve supplies in the hand is all gone. Whatever medial nerve supplies in the hand is all lost. But the skin over the thenar eminence, the sensations are going to be intact. The sensations of the skin over the thenar eminence are going to be intact. Why? Because this nerve goes above the flexor retinaculum. The nerve goes above the flexor retinaculum, and this is how you identify that the medial nerve is compressed in the carpal tunnel or whether it's compressed in the forearm or in the arm. अगर medial nerve forearm में इंजरी हो गया या फिर arm में इंजरी हो गया, there will be loss here in the hand as well as loss of sensations here over the thenar elements. But if the medial nerve is injured in the carpal tunnel, these sensations are going to be intact. I hope this is clear. Later we'll be discussing this again. हाँ, बाद में ये वापस डिस्कस करेंगे. So don't clear, students? Okay. This is it. Just one moment. Now students, I'll just brief you about our platform. There are some new courses which are coming up. So students, the NEET PG All India mock test is 17th of April. It's on 17th of April, 9 AM. The All India PG mock test. We're starting with Unacademy Lite for the NEET PG students. This is a special test series, okay, for the students. We're starting with the first year professional courses. Students, we're starting it from 20th of April. Do enroll for this course, 20th of April. So we are also launching the daily practice papers. Daily practice papers. So after every plus class, there will be a daily practice papers for you. Now students, we've got a plus subscription in which there are daily live classes, live quizzes, poll for the learners, study from the device of your choice, learning from the top educators, and now you can also access our question bank. An iconic subscription where you get the best of Unacademy and pre-planner. Some special class features in which there are daily live classes, live quizzes, poll for the learners, raise a hand technique. If you press this icon, you can talk to the educator directly. Never miss a class with proper notifications being given. And if you miss, you get lecture notes in the form of PDF. So anywhere, anytime you can access the class and get your doubts solved. So the students, these are our FMG students who have got very good ranks in the recently held FMG exams. Right? So we're starting with some new courses. The FMG 2022 Held Revision and MCQ batch. We've already started this. We've also started with this NEET PG 2022 Held Theory Revision batch, Doubt Clarification batch. Download the Unacademy app and subscribe to it. Okay, have a look at this. Plus subscription, iconic subscription, and the light subscription. Okay, I hope this is clear to all of you. Right, which doubts at the bolo in today's session? If you have any doubts, students, you tell me in today's session. Just one last thing I'll tell you before I stop for the day. One last thing. Now tell me, what is this ulnar bursa going to enclose? Ulnar bursa encloses tendons of flexor, digitorum, superficialis and profundus. Take care, this we know now. Ulnar bursa is going to enclose the tendons of flexor, digitorum, superficialis and profundus, and this ulnar bursa is continuous in the little finger, like this. The ulnar bursa is continuous in the little finger, right? It encloses the tendons of flexor, digitorum, superficialis and profundus, and this ulnar bursa is continuous in the little finger. One moment. Okay, I'll show you the slide itself. Look at this. What is this tendon of? What is this? What is this? What are these tendons of? These are the tendons of flexor, digitorum, superficialis and profundus. And what is this bursa which encloses it? The ulnar bursa. And this ulnar bursa is continuous in which finger? Little finger. Whereas what is this bursa which is enclosing the tendon of flexor pollicis longus? That's the radial bursa. And the radial bursa is continuous in the thumb. Radial bursa thumb में continuous होता है, ulnar bursa is continuous with the little finger. Now these three fingers have got a separate synovial sheath. इनका अपना synovial sheath होता है. The synovial sheath is a separate one. One moment, I'll just see if I can draw this for you, so it will be easy to understand. ये देखो, What is this? No, it's not writing. It's okay. So, ulnar bursa encloses the tendon of what? The flexor, digitorum, superficialis and profundus. It is continuous with little finger. The radial bursa encloses the tendons of flexor, pollicis longus. It is continuous with the thumb. What about these three fingers? Inca separate synovial sheath is there for these three fingers. You can see the slide. These three fingers have got a separate synovial sheath. Why are we discussing this so much? Because this is very important. So students, when we prick the finger for removing blood, you must have done hemoglobin estimation by Sally's method. So when you prick these fingers, out of these 5 fingers, which fingers do we prick? We prick any of these 3 fingers. कोई भी एक finger इसमें से prick कर सकते हो. Why? Because if there's an infection, the infection will remain only this much or this much or this much. Why? Because these 3 fingers have got a separate synovial sheath. I hope you can understand. But suppose if you prick this finger, little finger, and there's an infection here, students, infection from the little finger spreads to ulnar bursa. And from the ulnar bursa, it would enter the forearm space of Parona. You know the forearm space. If you prick this finger, the thumb, if there's an infection here, infection from the thumb would spread to radial bursa. Okay? We'll see this later. We'll see this in the next class. I'll tell you this once again. I hope everything is clear to all of you. Thank you, students. Thank you. Thank you. We'll stop you. We'll stop you. Thank you.